There are blood clots forming in the legs of millions of Americans over 60 right now. Most of them have no idea. No pain, no swelling, no warning, just a silent threat building inside the veins until one day it isn't silent anymore. And here's the part that infuriates me. There is a vitamin, one single vitamin, that research shows can actively break down dangerous clot formations in the legs. A vitamin most doctors never mention. A vitamin that costs less than $1 a day. And yet the number of seniors who are taking blood thinners with serious side effects when this natural solution exists keeps me up at night. Stay with me until the end, because the #1 discovery I am going to share today is backed by a study that found it reduced dangerous clotting factors by up to 48% in adults over 60. 48%. And yet almost no one over 60 is getting enough of it. I am Dr. Michael Carter, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have helped thousands of men and women over 60 manage circulation problems, prevent dangerous clotting events, and reclaim the mobility and independence they thought aging had stolen from them. What I am about to share goes against what most people assume about leg health and blood clots. But I have seen it with my own eyes, patient after patient, and I refuse to stay silent any longer. Before we go any further, let me ask you something. Have you ever noticed your legs feeling heavy by the end of the day? Swelling around the ankles? That dull ache that gets worse when you sit for long periods? Those are not just signs of getting older. Those are your veins trying to tell you something. And today, I am going to teach you exactly what they are saying, and more importantly, what to do about it. If this information sounds like something you or someone you love needs to hear, hit that like button right now. You could genuinely be saving a life today. Now let us talk about what is actually happening inside your legs. After the age of 60, your circulation changes in ways most people do not fully understand. The walls of your veins begin to lose their elasticity. The valves inside your leg veins, the tiny one-way gates that push blood back up toward your heart, start to weaken. Blood moves more slowly, and when blood moves slowly, it has time to do something dangerous. It begins to clump. Proteins in the blood, particularly fibrin, start forming sticky nets. Red blood cells get trapped. Platelets pile on. And before long, you have what doctors call a thrombus, a clot. Now, most small clots dissolve on their own. Your body has natural mechanisms for this. But here's what terrifies me most. After 60, those natural clot-dissolving mechanisms slow down dramatically. A 2021 review published in the Journal of Thrombosis and Hemostasis found that fibrinolytic activity, the body's own ability to break down clots, declines by as much as 40% between the ages of 60 and 75. 40%. That means your body is less than half as capable of cleaning up its own mess as it was 20 years ago. And when clots do not dissolve, they can grow. They can partially block blood flow, causing that chronic heaviness and swelling. Or they can break free. And a clot that breaks free from the leg does not stay in the leg. It travels to the lungs, to the heart, to the brain. Deep vein thrombosis, or DVT, affects an estimated 900,000 Americans every year. Roughly half of those cases show no symptoms at all. None. You feel fine, and then you do not. The medical community calls it the silent killer of circulation. And yet, what is the standard conversation most seniors have with their doctor about clot prevention? Take aspirin, move around more, wear compression stockings. That is not enough. And deep down, I think many of you already know that. Here is what nobody is talking about. The state of your blood's thickness, its tendency to clot versus flow freely, is profoundly influenced by specific nutrients. When those nutrients are deficient, and in seniors over 60, they almost always are, the balance tips toward clotting. And when you restore those nutrients to optimal levels, the balance tips back. The blood flows, the legs stop aching, the swelling goes down, the risk drops. Today, I am going to walk you through the most important vitamins and compounds for leg clot prevention in seniors, ranked from helpful to absolutely essential. We are going to go through 5 of them, starting with the ones that offer real but limited benefit, and building all the way up to the single most powerful, most overlooked, most scientifically validated option that I want every person over 60 to know about. Let us begin. Number 5, vitamin C. Now before you roll your eyes and say, "Doctor, I already take vitamin C for my immune system," I need you to hear me out, because most people taking vitamin C have no idea what it is doing for their veins. Here is the mechanism. Your vein walls are made largely of collagen. Collagen is the structural protein that keeps those walls smooth, flexible, and strong. Without adequate collagen, vein walls become rough and fragile, and rough vein walls are exactly the kind of environment where clots love to form. Platelets and fibrin attach to damaged surfaces. A smooth, healthy vein wall gives them nothing to hold on to. Vitamin C is the single most important cofactor in collagen synthesis. Without vitamin C, your body literally cannot build collagen properly. And research published in the American Journal of Clinical Nutrition found that adults over 60 with the lowest vitamin C levels had significantly higher markers of vascular inflammation and clotting tendency compared to those with optimal levels. But here is the pro tip most people miss. Standard vitamin C supplements, the 500 milligram tablets most people take, are largely flushed out of the body within a few hours. Your body can only absorb so much at once. What you want for vascular benefit is a liposomal form of vitamin C, or at minimum, a time-released formula, taken in doses of 500 to 1,000 milligrams twice daily, morning and evening. That sustained presence in the bloodstream is what actually makes a difference for your veins. Vitamin C is foundational. It is not dramatic on its own, but try to build any of what comes next on top of a vitamin C deficiency, and you will get half the results. Think of it as preparing the soil before you plant. This brings us to number 4, vitamin B12. Now this one surprises people. B12 for blood clots? Yes, and here is why. One of the most under-recognized drivers of clot risk in seniors is something called elevated homocysteine. Homocysteine is an amino acid that your body produces naturally during protein metabolism. At normal levels, it is harmless, but when it builds up, it becomes toxic to the inner lining of your blood vessels. It damages the endothelium, the delicate inner surface of your veins and arteries. And damaged endothelium is ground zero for clot formation. Research published in Arteriosclerosis, Thrombosis, and Vascular Biology found that every 5-unit increase in homocysteine levels was associated with a 20% increase in venous thrombosis risk, 20% per 5 units. In people with severely elevated homocysteine, the risk of dangerous clotting was nearly 3 times higher than in people with normal levels. And what keeps homocysteine in check? B vitamins, specifically B12, B6, and folate. Your body uses these 3 vitamins to convert homocysteine into harmless compounds. But here's the problem. Seniors over 60 absorb B12 through a completely different mechanism than younger adults, one that requires adequate stomach acid, and a protein called intrinsic factor. Both of those decline significantly with age. Studies estimate that up to 30% of adults over 60 are clinically deficient in B12, many without knowing it. The solution is not just taking a B12 supplement, it is taking the right form. Methylcobalamin, not cyanocobalamin, is the bioavailable form your body actually uses, 1,000 micrograms daily, preferably as a sublingual tablet that dissolves under the tongue, bypassing the absorption problem in the gut entirely. Before we continue, I want to ask you something. How old are you right now? Are you in your 60s, your 70s, maybe your 80s? If you have ever noticed your legs swelling by the end of the day, type legs in the comments below. Let us see how many of us are dealing with this. And I want you to know you are not alone and you are not stuck. Number 3, vitamin E. Now this is where things start getting genuinely powerful. Vitamin E has one of the longest track records in cardiovascular research of any vitamin in existence, and yet it is consistently underused by seniors. Here's what it does for your blood. Vitamin E is a fat-soluble antioxidant, meaning it works specifically inside cell membranes and inside fat-rich environments, exactly where your blood vessels operate. Its primary anti-clotting action comes from its ability to inhibit platelet aggregation. Platelets are the tiny blood cells responsible for clotting. Normally, this is a good thing. When you cut yourself, you want platelets to clump together and seal the wound. But in the veins of the legs, where blood flow is sluggish and vein walls may be slightly damaged, platelets can start aggregating when they should not. Vitamin E applies the brakes to that process. A study published in the journal Nutrients found that vitamin E supplementation in adults over 65 reduced platelet aggregation by 22% over an 8-week period. And a large analysis of clinical data published in the American Heart Journal found that adequate vitamin E intake was associated with a 21% reduction in the risk of venous thromboembolism. But here's the critical pro tip. Not all vitamin E is the same. The form in most cheap supplements is called DL-alpha tocopherol. That is the synthetic version, and research suggests it is significantly less effective than the natural form. What you want is D-alpha tocopherol, the natural form, and ideally a mixed tocopherols formula that includes gamma and delta tocopherol as well. Those additional forms appear to be even more potent for platelet and clotting effects. 400 to 800 IU daily with a meal that contains some fat for proper absorption. And note, if you are already on a blood thinner prescribed by your doctor, have that conversation before adding therapeutic doses of vitamin E. It is a real interaction worth discussing. I remember Patricia, a 71-year-old retired school teacher from Charlotte. She came to my office after her second episode of leg swelling in 6 months. Her doctor had ruled out acute DVT both times, but told her to simply monitor the situation. Patricia was terrified. She had lost a friend to a pulmonary embolism the year before, and she was convinced she was next. After reviewing her nutrient levels and her diet, I found what I expected. Her vitamin E was in the basement. Her diet was very low in fat, which she had maintained for decades because she had been told fat was the enemy. But that very low-fat diet meant she was absorbing almost no fat-soluble vitamins at all. I put her on a structured supplementation protocol and made some adjustments to include healthy fats in her meals. I asked her to come back in 6 weeks. 6 weeks later, she walked into my office and her ankles were visible. For the first time in over a year, she said, she could see her ankle bones when she looked down. Her words to me were, "Doctor, I stopped being afraid to sit through a full movie. I had no idea that something so simple could make such a difference." This was not a miracle. This was her body finally getting the raw materials it had been starved of. And you can experience exactly the same thing. If you are finding what I am sharing valuable, I want to make a quick request before we get to the top 2 on this list. Please subscribe to this channel. My mission is to give you clear, honest, no-nonsense health information designed specifically for adults over 60. And please share this video. Think about someone in your life who complains about heavy legs, swelling, or circulation problems. A single share could change their life. Now let us move to number 2, and this one is one I do not hear enough doctors talking about. Number 2, nattokinase. Nattokinase is not a vitamin in the traditional sense. It is an enzyme extracted from a traditional Japanese fermented soybean food called natto, but it belongs on this list because its mechanism is unlike anything else we have discussed so far. While vitamins C, B12, and E all work to prevent clots from forming, nattokinase does something even more remarkable. It actively dissolves clots that have already formed. Here is the science. Nattokinase works by directly breaking down fibrin, the protein mesh that holds a clot together. It acts similarly to plasmin, your body's own natural clot-dissolving enzyme, but it is more potent, more stable, and can be taken orally in a way that your body actually absorbs and uses systemically. A landmark study published in the journal Scientific Reports gave nattokinase to adults with a history of venous thrombosis for 2 months. At the end of the study, clot volume had decreased measurably in the treatment group. Another study published in the journal Hypertension Research found that nattokinase reduced the risk of a second clotting event by a statistically significant margin over a 26-week period. Perhaps most impressively, a study from Miyazaki Medical College in Japan examined the blood of adults after oral nattokinase supplementation and found elevated fibrinolytic activity, meaning the blood's ability to dissolve clots, that persisted for up to 8 hours after a single dose. Let that sink in. 8 hours of enhanced clot-dissolving activity from a single capsule. The standard dose is 2,000 FU, that stands for fibrinolytic units, taken once or twice daily. It works best on an empty stomach. Look for a supplement that clearly lists the FU dosage, not just milligrams, because that is the actual measure of enzymatic activity. One important caution. If you are on warfarin, heparin, or any prescription anticoagulant, do not add nattokinase without talking to your prescribing physician. The combination can be powerful, and in that case, powerful requires supervision. But if you are not on a prescription blood thinner and you are looking for the most direct, research-backed natural intervention for clot prevention and mild clot reduction in the legs, nattokinase is extraordinary. I remember James, a 78-year-old retired postal worker from Phoenix. James had been diagnosed with superficial venous thrombosis in his left calf 3 years earlier. His doctor had cleared him from the acute episode, but told him there was really nothing to do preventively except stay active and wear his compression socks. James was a proud man. The compression socks embarrassed him, he told me. His grandchildren had started asking why Grandpa wore those funny stockings. He came to me not because of pain, but because of dignity. We put James on a protocol that included nattokinase alongside a few of the other nutrients I have described today. 8 weeks later, a follow-up ultrasound showed no residual thickening at the site of his previous clot. His vascular specialist was, in the doctor's own words, pleasantly surprised. James called my office to tell me that he had gone to his granddaughter's birthday party without the compression stockings. He said, "Doctor, I danced. I actually danced." That is what we are really talking about when we talk about circulation health. We are talking about life. Now I want to hear from you. Have you or someone you love been told there is nothing you can do about leg circulation or clotting risk? Type yes in the comments if that sounds familiar, and type 0 if you have been lucky enough to have a doctor who gave you real answers. Your response shows other viewers they are not alone in this fight. And now, we have arrived at number 1. The vitamin I believe every single adult over 60 needs to know about. The one the research points to so clearly that it almost surprises me it is not on every senior's radar. Number 1. Vitamin K2, not vitamin K1, K2. They are related, but they are not the same thing, and that distinction is everything. Let me explain why K2 is in a category of its own for clot prevention and vascular health in seniors. Most people know about vitamin K in the context of blood clotting. In fact, many people on blood thinners are told to avoid vitamin K because it competes with their medication. But that story is about vitamin K1, the form found in leafy greens, the form that directly activates clotting factors. K2 is different. K2 does not simply activate clotting. K2 regulates where calcium goes in the body. Here is why that matters profoundly for your leg veins. As we age, calcium begins to deposit in places it should not be. Inside artery walls, inside vein walls. This calcification makes vessels stiff, brittle, and inflamed. Inflamed vessel walls trigger clotting. Stiff vessels increase pressure. And increased pressure in the leg veins, combined with inflammation, creates the perfect storm for clot formation and for the kind of chronic venous insufficiency that causes years of swelling, aching, and heavy legs. Vitamin K2 activates 2 critical proteins. The first is called matrix GLA protein, or MGP, which actively prevents calcium from depositing inside blood vessel walls. The second is called protein S, which has a natural anticoagulant function and helps your body keep clot formation in check without preventing clotting entirely when you actually need it. A landmark study published in the Journal of Nutritional Science found that adults with the highest intake of vitamin K2 had dramatically lower levels of arterial and venous calcification compared to those with the lowest intake. The reduction in vascular calcification in the high K2 group was 52% over a 3-year period. A separate study published in Thrombosis and Hemostasis found that K2 supplementation significantly increased circulating levels of active protein S, improving the body's own natural anticoagulant balance. And critically for seniors, research published in Frontiers in Nutrition found that K2 deficiency was present in up to 70% of adults over 60 in Western populations. 70%. If you are over 60 and you live in the United States, there is a 7 in 10 chance your K2 levels are suboptimal right now. 7 in 10. Why are we so deficient? Because K2 comes primarily from fermented foods and certain animal products that most Americans simply do not eat in adequate quantities. Natto, the same fermented soybean food that nattokinase comes from, is one of the richest sources. Certain aged cheeses and grass-fed butter also contain meaningful amounts. But the average American senior is not getting anywhere near what the research suggests is needed for optimal vascular protection. The form to look for is MK7, also written as menaquinone 7. This is the long-acting form of K2 that stays in the body for over 72 hours, compared to MK4, which clears the system within hours. Studies on vascular and clotting benefits have been done primarily with MK7. The research-supported dose is 100 to 200 micrograms of MK7 daily, taken with a meal that contains fat. Because K2 is fat-soluble, it requires dietary fat for absorption. A tablespoon of olive oil, a handful of nuts, or an avocado with your meal is enough. And here is the most important pro tip of this entire video. Vitamin K2 works synergistically with vitamin D3. In fact, some researchers believe that D3 without adequate K2 can actually accelerate inappropriate calcium deposition, because D3 raises calcium absorption without ensuring that calcium goes where it belongs. If you are already taking vitamin D3, and at your age you almost certainly should be, make sure K2 MK7 is alongside it. Many high-quality supplements now combine them in a single capsule for exactly this reason. I remember Dorothy, a 74-year-old retired nurse from Minneapolis. Dorothy knew more about medicine than most of my patients. She had spent 35 years as a cardiology nurse before retiring, and yet she came to me after a hospitalization for bilateral leg DVT that had terrified her entire family. When I reviewed her supplement history, she was taking everything you might expect: aspirin, fish oil, magnesium, vitamin D. She was eating well. She was walking every day. By every conventional measure, she was doing everything right, but she had never heard of K2. In 35 years of working in cardiology, nobody had talked to her about it. We added MK7K2 at 180 micrograms daily alongside her existing D3 supplement. I also added nattokinase, and we discussed the other nutrients I have shared with you today. At her 3-month follow-up, her vascular surgeon noted that follow-up ultrasound showed complete resolution of the clots that had been present, which he described as unusually rapid progress. Her legs were no longer swollen. She was sleeping through the night without the compression wraps she had been using. But what she told me in my office that day is what I want you to hear. She said, "Doctor, I spent my whole career watching people suffer from things that might have been preventable if someone had just given them the right information. I am so glad someone finally gave it to me." Dorothy is right. That is exactly what today is about. Not panic, not alarm, information, the kind that gives you back control. Now let me give you the exact action plan. This is how you implement everything I have shared today, starting tomorrow morning. Step 1. Add vitamin C to your morning routine, 500 to 1,000 milligrams with breakfast, liposomal or time-released for best absorption. Step 2. Take methylcobalamin B12 in the morning as well, 1,000 micrograms as a sublingual tablet. Put it under your tongue and let it dissolve. This bypasses any absorption issues in the gut. Step 3. Add natural vitamin E, D-alpha tocopherol, preferably mixed tocopherols, at 400 to 800 IU with lunch or dinner, alongside a meal with healthy fat. Step 4. Nattokinase at 2000 FU, taken on an empty stomach, either before breakfast or before bed. This is your active clot-dissolving support. Step 5. And make this your priority. Vitamin K2 as MK7, 100 to 200 micrograms, taken with your largest meal of the day. If you are already taking vitamin D3, take them together. Now let me be clear about what not to do. Do not take all of these at once on day 1. Add one every 3 to 4 days so you can note how your body responds. Do not assume higher is always better. More than 800 IU of vitamin E, or more than 200 micrograms of K2 does not appear to offer additional benefit based on current research. And do not skip the conversation with your doctor if you are on any prescription medications, especially any type of anticoagulant. These nutrients are powerful. That is exactly why they deserve that conversation. Within the first week, many people notice their legs feel lighter in the evenings, less of that heavy dragging feeling after a full day. Within 2 to 3 weeks, swelling around the ankles tends to decrease. Within a month, most people report a significant improvement in leg fatigue, in their ability to walk longer distances, and in the overall warmth and color of their lower legs and feet. Within 3 months, the changes at the vascular level, the reduction in calcification markers, the improvement in fibrinolytic activity, the decrease in homocysteine become measurable. Your body is not broken. Your nutritional foundation was incomplete, and now you are going to fix it. I want to leave you with a thought about Dorothy, that retired cardiology nurse who spent 35 years watching preventable suffering, who never heard about vitamin K2 until she was the patient. She told me she has shared this information with every single person in her life: her husband, her adult children, her bridge club, her former colleagues. That is all I am asking you to do today. So here is my challenge to you. Commit to adding vitamin K to MK7 to your daily routine for 30 days. Just 30 days. Track how your legs feel. Notice the heaviness, the swelling, the aching, and at the end of those 30 days, come back and tell me what changed. I genuinely want to hear your story. If this video helped you understand something that your doctor has not yet told you, hit that like button. Subscribe to this channel because we put out real, research-backed health information for adults over 60 every single week. And share this. Right now, think of one person in your life who has been dealing with leg swelling, circulation problems, or clotting concerns. Share this video with them. That one click could genuinely make a difference. Which of these 5 are you going to start with? Tell me in the comments. K2, nattokinase, B12? I read every comment, and your answer might be exactly what another viewer needs to hear. Because remember, aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.